Picture this. You walk into a totally empty room. There's no one there. It's completely silent. But if someone infected with measles was standing in that exact room, just coughing, up to 2 whole hours ago, you could actually catch their illness simply by breathing the air. Crazy, right? That is the terrifying and visible reality of the measles virus.
Hey everyone, and welcome to this explainer. I am so incredibly excited you're here today because we're about to decode the entire journey of the measles virus. We're going to take this from a microscopic threat to understanding exactly how it became a highly preventable global issue. There is just so much fascinating science here, so let's jump right in. Here is a quick look at our roadmap for today. We'll start with the highly contagious nature of the virus, track its invasion and the stages of the disease, and then look at the severe risks involved. After that, we'll explore how modern medicine fights back, and finally, wrap up with the absolute power of prevention.
All right, let's get into our first section and meet our microscopic villain, the highly contagious threat itself. So, measles, which goes by the official medical term rubeola, is a fiercely contagious viral disease. The culprit behind it is an RNA virus from the morbillivirus genus. And honestly, the way it operates is just incredibly efficient. It spreads right through the air via respiratory droplets. So when an infected person breathes, coughs, or sneezes, they're basically launching these tiny, invisible packages of viral RNA out into the environment, just waiting to be inhaled by the next host.
To really put this into perspective, measles isn't just contagious. It is exponentially more infectious than both the seasonal flu and COVID-19. It's in a league of its own, which is exactly why it remains such a persistent public health menace.
So, what actually happens when it breaches our defenses? Let's move to Section 2 and trace the virus's journey through the body.
Think of this like a tactical invasion. Step 1. The virus enters through the nose or mouth. Step 2. It wastes absolutely no time and immediately begins replicating in the respiratory tract. Then, for Step 3, it marches into the nearby lymph nodes and slips right into the bloodstream, a phase doctors call viremia. Step 4 is dissemination. It spreads throughout the whole body, triggering this massive immune response that causes a widespread rash. And finally, Step 5. As it leaves, it essentially trashes the place, causing a temporary weakening of your immune system and leaving the door wide open for other bugs to attack.
But well before that famous rash even appears, the patient goes through what's called the prodromal stage. This is your early warning system. Aside from a spiking high fever, doctors look for a specific rule of 3. The 3 C's. That's a cough, coryza, which is just a fancy medical term for a severe runny nose, and conjunctivitis, or red inflamed eyes. If you have those 3 C's combined with a fever, the viral invasion is well underway.
Now, here's a really fascinating detail. There's an even more specific clue that doctors look for, called Koplik Spots. These are tiny, pinpoint white spots that pop up inside the mouth, usually right on the inner cheeks. And the wild part? These spots appear before the skin rash even starts. For a doctor playing detective, spotting those little white dots is a massive telltale sign that measles is the culprit.
Following those spots comes the defining feature we all know, the red maculopapular rash. But it doesn't just appear randomly all over the place. It follows a very strict descending pattern. It starts up high, on the face, and right behind the ears, and then it systematically spreads downward to the trunk, the arms, and finally the legs. When this top-to-bottom wave fully covers the body, you are visually looking at the absolute peak of the illness.
Which brings us to a much more serious part of the story. Section 3, severe complications, and what happens when the threat escalates.
Measles is far, far from just a harmless childhood rash. The complications can be entirely devastating. Pneumonia is actually the leading cause of measles-related death. We also frequently see severe ear infections and dangerous diarrhea. Even more terrifyingly, it can cause encephalitis, which is severe brain swelling, and even permanent blindness, especially if the patient happens to be deficient in vitamin A. And then there's SSPE. It's a rare but deeply tragic and fatal neurological complication that can strike a patient completely out of nowhere, literally years after they've recovered from the initial infection.
Okay, so how do we fight back? Let's dive into Section 4, diagnosis and medical care.
A red rash can mean a lot of different things, which is where doctors really have to put on their detective hats. They have to differentiate measles, with its strict top-to-bottom rash and those 3 C's, from illnesses like rubella, which is much milder, or chickenpox, which features those very itchy blisters, or even dengue fever, which presents with severe joint pain.
A correct diagnosis relies entirely on this precise pattern recognition, which is then usually confirmed by a blood test or a swab.
Let's ground this with a real-world scenario. Imagine an unvaccinated child who comes in with classic measles. How do doctors treat them? Well, they are successfully managed with supportive care and vitamin A. But did you catch what's glaringly missing from that statement? There is absolutely no mention of a measles cure.
And that brings us to a massively important point. There is absolutely no specific, routine antiviral medication to cure the measles virus itself. Since we don't have a magic pill to just kill the virus, treatment revolves completely around rigorous, highly structured supportive care. Doctors focus on intense hydration and nutrition. They use paracetamol to keep those spiking fevers under control. They'll give oxygen therapy if the lungs are struggling. And they will only prescribe antibiotics if a secondary bacterial infection, like pneumonia, decides to crash the party.
But there is one specific, incredibly powerful weapon in the medical toolkit: vitamin A therapy. Now, this isn't just taking a standard daily gummy vitamin. This is a highly targeted, World Health Organization recommended intervention. Administering high doses of vitamin A to measles patients is a literal lifesaver. It drastically reduces the severity of those complications, it plummets the mortality rate, and it actively protects the eyes from the risk of permanent blindness we touched on earlier.
Which leads us to our final and honestly most important chapter, Section 5, Building the Shield Through the Power of Prevention. The contrast in vulnerability here is just staggering. An unvaccinated person who is also vitamin A deficient faces a towering, massive risk from this airborne virus and all its severe complications. However, for someone who is fully caught up on a 2-dose vaccination schedule, that risk practically flatlines. It is night and day. That is the incredible scientifically proven protection offered by immunity.
So, the real question is how we build that communal shield. It requires 2 doses of the MMR, or a similar measles-containing vaccine. And when a high enough percentage of a community gets these 2 doses, it creates something truly magical called herd immunity. It's basically an invisible communal wall that protects everyone, including those who are too young or maybe too immunocompromised to get the shot themselves. It also actively prevents severe maternal risks during pregnancy. And let's be absolutely clear about the science here. This 2-dose strategy is universally endorsed by the WHO, the CDC, the American Academy of Pediatrics, and UNICEF.
Which leaves us with a final, slightly provocative thought to ponder today. We know this virus's every move, we understand its biology inside and out, and we have a highly effective, globally recognized shield against it. So, if measles is almost entirely preventable, what is our collective role in eliminating it worldwide? Understanding the science is step 1 for sure, but recognizing the critical importance of public health, that's step 2. I really hope this breakdown gave you a fresh, clear perspective on this incredible medical battle. Thanks so much for joining me on this explainer, and keep learning.